Hello, everyone. Welcome to my YouTube channel. My name is Silvana. I'm a certified functional nutritionist, and I like to discuss things pertaining to women's health. This week, we are going to cover a topic that is not going to be very comfortable, but I feel that it's a very important topic to discuss. We're going to talk about miscarriages. I do realize that this may feel other people uncomfortable, or hearing the word miscarriage may make you feel uncomfortable, but I feel that it's an important topic to outline because many women experiencing miscarriage are left completely unsupported by family members, friends, and the medical community. I'd also like to talk about the role of male for aspect fertility in miscarriages. Men play a pretty significant role in conception, but the role in miscarriages is often not discussed. In fact, the last time I heard anything regarding male fertility was probably 10 years ago, 11 years ago in Spain. And since moving to the United States from Spain, I have never heard a doctor until recently talk about the importance of male fertility and the role that that plays in miscarriages. So let's dive in. Okay, now let's take a look at the definition of miscarriage. Miscarriage, also called early pregnancy loss, is pregnancy loss that happens before 20 weeks. It's estimated that between 10 to 20 in 100 known pregnancies, or 10 to 20%, end in miscarriage. Some research suggests that more than 30% of pregnancies end in miscarriage, and many end before a person even knows that they're pregnant. Most miscarriages, 8 out of 10, or 80%, happen in the first trimester before the 12th week of pregnancy. Let's keep going. Okay, now let's take a peek a little bit deeper into miscarriage. Miscarriage is generally defined as the loss of pregnancy before viability. An estimated 23 million miscarriages occur every year worldwide, translating to 44 pregnancy losses each minute. The pool risk of miscarriage is 15.3% of all recognized pregnancies. The population and prevalence of women who have had one miscarriage is 10.8, 2 miscarriages is 1.9, and 3 or more miscarriages is 0.7. Risk factor for miscarriage include very young or older female age, younger than 20 and older than 35. Older male age. I'd just like to take a pause. Older male age, older than 40 years. Very low or very high body mass index. Black ethnicity, previous miscarriages, smoking, alcohol, stress, working night shifts, air pollution, and exposure to pesticides. The consequences of miscarriage are both physical, such as bleeding or infection, and psychological. Psychological consequences include increase in the risk of anxiety, depression, post-traumatic stress disorder, and suicide. Miscarriage, and especially recurrent miscarriage, is also sentinel risk marker for obstetric complications, including preterm birth, fetal growth restriction, placental abruption, and stillbirth in future pregnancies, and a predictor of long-term health problems such as cardiovascular disease and venous thromboembolism. Let's keep going. Okay, let's dig a little bit deeper. Consequences for mental health in future pregnancies. As we have already established, miscarriages are associated with increased level of distress, anxiety, and depression in the population concerned. Psychological symptoms such as stress and depression have been linked to adverse pregnancy outcomes, including preterm labor and low birth weight. Therefore, identifying women at risk and designating appropriate interventions in order to prevent such symptoms during pregnancy can reduce adverse effects not only in the months after the miscarriage, but also during the course of any future pregnancies. Okay, I'm going to take a little sidebar here. Identifying women at risk. There are known risk factors such as blood clotting disorders and genetic predispositions that would warrant the use of anticoagulant shots through the entire pregnancy in order for a woman to maintain a pregnancy. However, insurances do not cover this type of testing unless women have experienced 3 miscarriages. I know this from a personal experience. I have a genetic mutation that would warrant the use of anticoagulants and had to experience 3 miscarriages before I was tested. So, my question is, and by the way, this mutation that I have, 1 in 50 Europeans have this mutation. And I'd like to pose a question. How many Americans are of European descent? So, if we know that this is a risk factor, why are we waiting for 3 miscarriages to occur before we test for this risk factor? Just a thought, but let's move on. Okay, before we move on to recurrent miscarriages and male factor infertility, I wanted to do a little sidebar. I wanted to bring up a topic that I mentioned briefly earlier. Over 12 years ago, while living in Spain, our doctor told us that usually when there's an issue with fertility, it's a little bit of both parties, not one person. So when we moved back to the United States, I brought that up to several different providers who simply told me, well, we just don't do that here. Anyway, let's get back to this. I'm going to skip the very top because you already know what a miscarriage is and move towards the bottom. Remarkably, the situation significantly afflicts expecting parents, whereas maternal factors such as age and previous pregnancy loss rate are commonly reported as risk factors. Although previously underestimated, existing evidence suggests that male factor is a possible cause of recurring pregnancy loss. A non-systemic literature review was conducted in PubMed and Scopus databases for articles written in English investigating the possible association of the male factor in recurrent pregnancy loss. The eligible studies were synthesized in a narrative review format upon discussion and consensus among the authors after being previously independently assessed and selected. Lifestyle, obesity, genetic predisposition, chromosomal abnormalities, endocrine dysfunction, anatomical abnormalities, immunological factors, infections, and oxidative stress can result in poor embryo development and recurring miscarriage. Let's keep going. Okay, before we get to this next section, we're going to be talking about the egg, the fertilization of an egg. Essentially, we're going to be talking about the male's role in a fertilized egg. If you have little ears around you and you just don't feel comfortable hearing about this topic, you should probably skip to the end. Okay, so here we go. High levels of sperm DNA fragmentation have been shown to double the likelihood of a miscarriage occurring. While many of these will be a single sporadic event, some couples will suffer repeated or recurrent miscarriages. Recurrent miscarriage can be caused by several factors, including abnormal chromosomes in the fetus, female hormonal problems, or issues with the woman's womb. Another significant factor in recurrent miscarriage is the quality of the man's sperm DNA. Sperm DNA is the most important part of the sperm. It contains the genetic instructions that make a baby look and act like its parents. Sperm DNA can be damaged during sperm production and transport. This damage is known as DNA fragmentation. High level of sperm DNA fragmentation have been shown to double the likelihood of a miscarriage occurring. Examines research shows that sperm from men whose partners have a history of miscarriage have a higher level of sperm DNA fragmentation than sperm from those whose partners deliver healthy babies. We have observed high sperm DNA damage in over 85% of men whose partners had recurrent miscarriages. This was true for couples who conceived naturally as well as those who conceived with fertility treatments. So it seems like the sperm plays a pretty significant role, or the quality of the sperm plays a pretty significant role. Yet, I want to remind you, this is something that is rarely looked at unless you're going to an IVF clinic and receiving this type of assistance in fertility. Let's keep going. Okay, and just one last one before we move on. Recurrent miscarriage linked to faulty sperm. The early stage study from scientists at Imperial College London investigated the sperm quality of 50 men whose partners had suffered 3 or more consecutive miscarriages. The research published in the journal Clinical Chemistry revealed that compared to men whose partners had not experienced miscarriage, the sperm of those involved in the study had a higher level of DNA damage. Traditional doctors have focused attention on women when looking for the cause of recurrent miscarriage, according to Dr. Jana Jesayena. Anyway, this isn't to tear down men. This is just to highlight the fact that we've completely ignored a very important factor in recurrent miscarriages. Let's keep going. Okay, and now let's talk about emotional support. If you've experienced a miscarriage or multiple miscarriages and feel that you need support, it is essential that you reach out to a professional who can help you. And then there are some additional instructions or additional symptoms to watch out for, such as excessive or irrational worry, trouble sleeping, concentrating, or taking care of yourself, trembling, muscle tension, sweating, or nausea, loss of interest in normal activities, tearfulness, feeling hopeless, worthless, or numb, flashbacks or nightmares, thoughts of hurting yourself. Let's move on. Before we move on and talk about how to support a loved one who has experienced a miscarriage, I do want to recognize that it is a difficult topic to discuss. I realize that. And I remember several years ago having seen a friend post about it on Facebook. I thought to myself, I just couldn't understand why the person was posting about the miscarriage. And then I had my first miscarriage and I got it. It's really about the process of grief. It's talking about a significant loss and going through that grieving process. We are not meant to hold in and bottle in and pretend like these things didn't happen. That is absolutely not healthy for us. And also, it's important to shed light on this topic. It's a frequent occurrence. Many women are experiencing miscarriages and are suffering in silence. And in all honesty, I wouldn't dare share some of the stories, but some of the experiences and the way that women who have experienced miscarriages are the way that they're treated in the medical system, it's absolutely shocking. But anyway, I just would like to encourage loved ones to really hold space for women who are experiencing or have experienced that, because it is not an easy thing to go through. And I really want to move past the shame and past the let's talk about normalizing it. I know it's another thing to normalize, but it's something that happens frequently. So until we can figure out how to support women to prevent miscarriages, then we should essentially be supporting women through the process. So anyway, let's talk about how to support women who are going through it. Honestly, I'm going to start with what not to say. These are some of the what not to says. Please don't say, don't worry, you're young. You'll always be able to have another baby. Don't say that. Don't say it wasn't meant to be. Don't say it was probably for the best. And don't say at least you have other children. What you should instead say is, I'm very sorry that you have lost your baby. This must be really difficult for you. Or even, I don't know what to say. That says so much. And I really want to close this with, be kind to people. You genuinely don't know what is going on to the person next to you in the grocery line. Because I can tell you many times I've walked through normal life and normal experiences and just living life going through a miscarriage. And the person next to me didn't know. But I did experience kindness, and it means the world. You just don't know what anyone is going through. So hold space for kindness and be kind to the people around you. I hope that this shed light on this very important topic. I would love comments, opinions on this. And if you've experienced a miscarriage, if you have no one to talk to, please reach out to me. I am here for you. And then next week, we'll be talking about perimenopause and menopause. So be sure to tune in.